Arise, America.
And President Joe Biden has ordered a new national research on long COVID, while also directing federal agencies to support patients dealing with the condition. Long COVID is the catch-all term for a hydra-headed condition whose symptoms can include brain fog, recurrent shortness of breath, pain, and fatigue. It is roughly estimated to affect as many as 1 in 3 people who recover from COVID-19, although the severity and duration of symptoms vary.
Millions of Americans may be struggling with lingering health effects, ranging from things that are easier to notice, like trouble breathing or irregular heartbeats, to less apparent but potentially serious conditions related to the brain or mental health. At the President's direction, the Department of Health and Human Services will be leading a government-wide response to long COVID, focused on 3 main goals: improving care, services, and other support for individuals with long COVID, enhancing education and outreach among the public, private sector, and the medical community, and advancing research to support both goals. And of course, we'll collaborate with academic, industry, and state and local partners to better understand long COVID. Through it all, we'll continue to assess and highlight the long-term effects of COVID-19 on our hardest hit and highest risk communities, and make sure they receive the support they need. To do this, we're launching the first ever interagency national research agenda on long COVID, a national research action plan. HHS will lead a government-wide interagency coordinating council, which will involve experts from the Department of Defense, Veterans Administration, the Labor Department, and many entities across government to coordinate both public and private sector work to advance our understanding of long COVID and to accelerate efforts to prevent, detect, and treat it. In real time, we will share lessons on how to prevent, detect, and treat long COVID. And this coordinated effort will help ensure our research is being directed toward the people who need care the most. We continue to focus on improving care. If we receive additional financial support for it from Congress, we will launch new centers of excellence in communities across the country to provide high-quality care to individuals experiencing long COVID and to get best practices out there to physicians across the country. We've launched efforts across the NIH, the CDC, and the Veterans Administration, including the landmark $1.1 billion Recover Initiative, to better understand long COVID and accelerate scientific progress. And we are providing Americans experiencing long COVID information about where they can access the resources and support they need, as well as helping them understand if they have a disability and educating them on their rights.
Well, let's bring in Arise correspondent Rotimi Kade to give us his analysis on the latest COVID developments. Rotimi, thank you very much for joining me. Now, what do you make of this latest study on second booster shots? Does this in any way suggest that the booster shots are less effective when you consistently take them or don't guarantee longer immunity?
Well, also a very good question. It is either or. Different studies and research actually show that booster shots wane over time in people over 60, hence the need to be taking the shots from time to time. The recent study from Israeli scientists, Science Institute actually revealed that protection from Pfizer vaccine, for instance, disappears after 8 weeks. That's 2 months. That's even shorter than expected, even though that is actually predicated on individual immunity. So despite intense investigation and to find the causes of the long-term COVID, obviously scientists have not been able to understand the root cause of it, and the treatments largely, which of course is focused on helping patients to actually cope with, the symptoms as they try to actually rebalance, daily routines. And that begs the question on what is the long-term strategy. Should there be new variants, which is highly likely. But, the Biden administration have, other challenges, and which are timelines and, of course, funding. The administration have been criticized over time for not setting a timeline as to when this COVID would end. Do they have some sort of plan to ensure that we have a final nip in the board kind of strategy, rather than depending on the shots or perhaps maybe the booster shots, which is obviously not effective from what we've seen. And secondly, is funding from Congress. After the reopening of the economy, Congress has been very reluctant in funding research. Has been funding, the operations and of COVID. The last stimulus that was passed by the House of Representatives was actually turned out in the Senate, which frustrates this administration in tackling this long-term COVID. So in a nutshell, booster shots actually have not been proven to be effective.
Well, Rotimi, I know that there has been a debate over whether or when Americans might need additional boosters. Where exactly are we now on the U.S. booster strategy?
Well, the CDC actually said that adults over 50 should take boosters to protect them, because adults within that age range, 60 and above, 50 and above, I should say, I think it's been reduced now from 60 to 50, stands the risk of getting infections that could lead to hospitalization or eventual death. So it is the advice, that's the advisory from the CDC and the FBI to actually ensure that people within that range are protected. Most likely for people below that age range do not necessarily need boosters, except you are immunocompromised, which means you have an underlying health conditions that will warrant you to actually take, the double shots.
Well, Rotimi, the good news shared by Anthony Fauci was that we are out of the woods with Omicron. But the Senate's funding doesn't seem to help much to sustain this, does it?
No, it doesn't, because as I said earlier, it's been highly politicized. You need a bipartisan support for you to be able to pass this effectively. Republicans, not all Republicans, but vast majority of Republican lawmakers have politicized this and feel that the conspiracy theory going on around about the Omicron variants and the earlier COVID-19 disease is just a hoax, and that causes a lot of confusion, even in the hearts and minds of moderate Republicans who feel that they had to stand on the fence at this time, not supporting Democrats to ensure that you plan ahead. Because I think one of the biggest mistakes that the United States actually did in the past was not to be prepared, and that cost over 500,000 people's lives. So what the administration essentially is saying is that we need an action plan that will help us be well prepared should, in case we have different variants that may even be more deadly than what we've experienced so far.
Well, Rotimi, I guess we'll just have to sustain this campaign at the Congress for more funding. Thank you very much, Rotimi, for joining me on the program.